I wanted to take a moment to update the public on two new orders, executive orders from the governor. We have Order 20 We have two new orders. The first one is 20-82, which is a order to limit social gatherings of 10 people or more and to work remotely from home if you have that ability to do so. That is a statewide order. Of course, if you have the ability to telecommute, to work from your home or another place where people do not congregate or gather, that is an important concept in our COVID-19 response. And of course, contained within Order 28.3 and 8.2 is a health advisory, and I'm speaking directly to my parents now who are over the age of 65 years old, to stay at home and take such other measures as necessary to limit exposure to COVID-19. And then of course, if you have any underlying health risks or a immune defense deficiency in your body, regardless of your age, it is critically important that you maintain that home shelter status. And that's true for anybody in the state of Florida, whether you're healthy, compromised, over the age of 65, you need to take personal responsibility for your future and your health, the health of your family, the health of your friends. That means staying at home unless it's critically necessary to leave your home. I also want to update you briefly on two new emergency orders executed by the county administrator as a result of the discussions and deliberations of the executive policy group, which is the policy-making body during times of emergency. Emergency order number 2, Palm Beach County COVID-19 response, actually has some far-reaching restrictions. It will restrict all non-critical retail and commercial business locations from operating and are ordered closed except to the extent necessary to perform minimum basic operations. This is a 12-page order, and there are many exemptions or definitions as to what is critical and non-critical. We believe that all the businesses operated in Palm Beach County are essential, but the county administrator and the executive policy group have decided to take restrictions one step further and define what is critical and non-critical at this time. The second order, signed by the county administrator in conjunction with the executive policy group, speaks to the immediate closure, effective immediately, as of 4 o'clock today. All parks in the county shall be restricted from any public access. That's not just county regional parks, that are municipal, those include municipal parks as well. So this order preempts and goes into the entire county, regardless of incorporated or unincorporated areas. So all parks will be closed. Effective immediately, all golf courses are closed to public access. That is, regardless of whether it is a public-funded facility or a private golf course. Effective immediately, the Sheriff of Palm Beach County and other law enforcement personnel are hereby authorized and directed to enforce this directive. So as of this time, I've updated you on 2 executive orders from the governor and 2 new orders from the county level that restrict our daily lives. I am cognizant of how difficult this is on our community, on our state, and our nation, and the world at large. I was asked recently, how would I respond to somebody that says, you know, these restrictions are overbearing or burdensome? And I would say that anytime you abide by the protocols of the CDC and the orders of your government, that is to shelter in place, to remain 6 feet from people, to avoid congregations of people, every time you do that, you're investing in the future of your community, the community that we love. We have an opportunity, especially in these critical early stages, to flatten this curve. And every time you're bothered and annoyed and frustrated by the actions that you have to take to protect yourself, remember it's an investment in your community and the health of your family and the health of your state. I hope that we all take this level of personal responsibility to the highest level, especially in this critical phase of the future of our community. With that said, we will open it up to questions towards the end of the briefing, but I'd like to turn it now to my dear friend and colleague, Dr. Alina Alonso, the Director of the Florida Department of Health, Palm Beach County. Doctor?
Thank you so much. Thank you, Mayor. Very well said. The Florida Department of Health objective since we began is working closely with our state, federal, and local public health partners to limit the spread of this virus. I would like to thank the diligence and the hard work of law enforcement, fire rescue, healthcare workers, and frontline staff throughout Palm Beach County. I'd like to thank the media, who is sitting right now in the sun, listening to what we're saying to be able to spread it to the rest of the community. Your voice and your messaging is very important to what the members of our community hear and how they react. So thank you for that. These people are putting themselves in the front of this everyday situation that we're in. The dedication, the bravery, and the sense of calm is making a difference in our community. A special thanks I want to go out to our Palm Beach County Health Department team. They have been just unbelievable. I'm so proud of them. They're going above and beyond 24 hours a day for the past 3 months. Finally, I'd like to thank the leadership standing behind me who have been working tirelessly to slow the spread of the virus here in Palm Beach County and keeping you, the public, informed. The updates for the numbers as of 3:15 this afternoon, the number of U.S. cases is 60,115 with 827 deaths. The Florida cases are 1,682, and there have been 22 deaths. For Palm Beach County, we're up to 118 cases, and we have 3 deaths. The leading counties are Dade with 406 deaths. 406 cases. They have 0 deaths. Please quote me right on that. Dade has 406 cases and 0 deaths. Broward has 355 cases with 3 deaths. And Hillsborough is right behind us at 106 with 0 deaths. We know that these numbers will continue to rise, and before long, if they're left unchecked, if we don't do what the CDC and what the experts in epidemiology and in the science of pandemics are telling us to do, South Florida will be in the same situation as New York City is today. We can stop that from happening. I'm here to plead to everyone watching this press conference, everyone who hears these words, to stop and commit to the social distancing messages that we're giving you. That means making the hard sacrifices, uncomfortable changes to our daily lives that we're asking you to do. The mayor said it beautifully. I believe it's better to be annoyed now than to suffer catastrophic consequences that will occur if we don't take this seriously. If you're at high risk category, you need to stay home. Have your groceries delivered to your door. Stay away from groups gathering. That includes the pool, your local community gatherings, even your church services or your synagogue or your home, your worship where you go. You need to stay home. If you've traveled from an area that has sustained community transmission, stay in your home when you come here to Florida for 14 days and check for symptoms so that you don't spread it to your neighbors or to your elderly mom or to your elderly grandmother. It can make the difference between life and death for that person. Take advantage of our community networks. I have talked to several people at the condominiums and the different places. They have set up networks where you can work with one another, get to know your neighbor on the phone, make a phone call, say hello to somebody you haven't talked to in a while. You can do many things without leaving your home. Stay in touch with your neighbors. They may need your help. You may be able to help them. And you, most of all, throughout this stressful time where there's fear and there's uncertainty, we need to be kind to one another. Sometimes our nerves get a little razzled when we're frightened. Take some time and be kind to one another. Thank you.
Thank you, Dr. Alonso. The next speaker will be Chief Reginald Duran, Palm Beach County Fire Rescue Chief and Administrator. You're going to start to hear about our first responders, both police officers and fire rescue and paramedics, being quarantined and in fact being exposed to and actually having coronavirus. And this is going to be a theme that I think will continue for some time. And so when we talk about the sacrifices we're making as a community, I want you to understand that the men and women that Chief Duran lead and that the Sheriff's Office and Sheriff Bradshaw lead, these men and women are putting their lives on the line for us every day. And we have a moral obligation to abide by the restrictions in place by your government because they're the ones most likely to be injured by our lack of attention to this issue. So without further ado, Chief Reginald Duran, thank you, sir, for being here today.
Thank you, Mayor. Good afternoon, citizens of Palm Beach County. I first want to reassure you that Palm Beach County Fire Rescue stands prepared to serve the citizens just as we always have. I want you to recognize this is a community effort, and as I've said before, our firefighters are a part of this great community. Please understand the investment we're making, we don't take very lightly, that we're responding rapidly, just as we always have, to meet your demands. I want to ask, as we work together, to please be frank and honest when you answer calls during your 911 calls, if you have to make one. Please, let us know what your concerns are. Let us know what your history is. Answer every question. Listen to every question. No matter what you say, no matter your response, no matter the distress, no matter the concern, Palm Beach County Fire Rescue is going to respond. Likewise, upon arrival, follow the commands. Listen to what they're asking you to do. Answer every question. Nothing is going to change regarding your care. Absolutely nothing is going to change. We're going to provide that same level of excellent service no matter the circumstance. But we have to work on this together. Please remember, our firefighters, our dispatchers, our mechanics, all the employees of Palm Beach County Fire Rescue have families as well. And it's important that you be honest, and let's work through this together. Let's help each other get through this, and we will. Thank you.
Thank you, Chief. It's now my honor to invite up to the podium Commissioner Mac Bernard, who's a colleague of mine on the Board of County Commissioners. He's also joined here by Commissioner Greg Weiss. I've also had a special request from who I call our senior county commissioner, and that would be Commissioner Mary Lou Berger, that due to age restriction, she is leading by example and sheltering at home and will not join us today. Commissioner Bernard, thank you, sir.
Thank you very much, Mayor. I just want to thank the county administrator as the incident commander working this issue that we're dealing with and thanking all of our 6,000 employees in Palm Beach County who are working hard to try to make sure that we're solving this issue. As Dr. Alonso mentioned, we don't want Palm Beach County to become like New York. And I believe that there are 5 things that we must do to avoid becoming New York. First of all, we need the help of every resident in this county and non-resident to help us stop the introduction and spread of COVID-19. Everyone. Second, we must protect our seniors. Palm Beach County is home to over 1.5 million residents, and 25% of our population are seniors. That's 375,000 seniors that resides in this county. And we're urging all of our residents to help us protect our seniors. Third, testing. Our testing numbers in this county are way, way too low. As of 10 a.m. this morning, only 812 residents in Palm Beach County have been tested. Do the math, 812 residents tested when we have 375,000 seniors and over 1.5 million residents. Among counties our size around the whole state of Florida, we are dead last in per capita for testing. I am urging the governor the President of the United States, since he recently issued a declaration of emergency for the state of Florida, to release and allow FEMA to create 2 drive-through testing sites in Palm Beach County, one in South County and one in the central part of the county. Folks, this is a matter of life and health, and we need that for all of our residents in Palm Beach County. Fourth, as Dr. Alonso mentioned, we need to practice social distancing. The President declared the state of emergency for Florida. We're urging all of our residents to practice it. We've issued the order, and if we don't abide by this order, the next step we will have to do is a shelter in place. And finally, as Dr. Alonso mentioned, we want to protect all of our first responders, our law enforcement officers, and all of our healthcare workers who are working day in and day out to protect our residents. And we will work tirelessly to make sure that we get all of the N95 masks, ventilators, face shields, medical gowns, and gloves for our responders. And finally, folks, we're just asking you to please help us bend this curve and fight against this war against COVID-19. Thank you.
Thank you, Commissioner Bernard. And our final speaker will be Virginia Baker, our county administrator, and then we will open it up to questions. Ma'am?
Mayor, thank you. Good afternoon. Again, we have been tirelessly working with our community partners. We are one county, we are one team, and we are one community. And so we must act accordingly. We must, and I'm going to continue to reiterate what has already been said, and that we are asking our residents to remain at home. Stay at home. If it is not critical for you to leave your residence, you should remain at home. We will be issuing some additional emergency orders, as the mayor pointed out, and we will make those available in detail on our website. And those particular ones deal with businesses in our community. We started out setting the example. Palm Beach County has modified our county operations to minimize the exposure to the public and to our employees. We have put many of our services online, and they are available to the public or through telecommunications. They can also mail the information to us. We have reduced or eliminated on-premise, in-person interaction. It is working well for us, and I have been in touch with some of the business community. It is working well with them as well. I want to address the terms essential and non-essential. Please hear me. Let me make this perfectly clear. All of the businesses in Palm Beach County are essential business. Otherwise, they would not be sustainable. So we are looking at businesses in our community where we have to separate as critical businesses that are mission responsible. And so there are others that are not so designated toward our critical needs at this point. So we will be looking at addressing those and addressing the non-critical, which will be some of our retail and commercial businesses, meaning all that are not expressly deemed critical in Section 4 of our emergency order. So we will be specific about what those are. We have worked in conjunction with the Governor's Executive Order 2070, 2071, 2072, and 2083. And so we are working so that, as well as with the President's order. This will deal with exceptions to healthcare providers, public health operations, including but not limited to hospitals, doctors, dentist offices, urgent care clinics, and rehabilitation facilities, physical therapy, mental health professionals, psychiatrists, therapists, research laboratories and services, blood banks, medical, cannabis facilities, medical equipment, devices, and other healthcare manufacturers and suppliers, reproductive healthcare providers, eye care centers, that some of us need. Home health care services providers, substance abuse providers, medical transport. I'm not going to read all of them in detail, but I wanted you to be really clear on the medical aspects of things. We're also opening up and making sure that you have accessible to you grocery stores, farmers markets, and all of those related type of entities. Businesses that are engaged in food cultivation, including farming, livestock, and fishing. There are a myriad of them that we have outlined, and I will be happy to discuss them with you. Again, they will be placed on our website, and again, these are all critical to the well-being of our community as we face this ever-changing virus that we have in our community. This will not be the last time that we issue executive orders, so please stay tuned. We will keep you abreast of all of our changes as we move forward. As the mayor stated earlier, we are closing because we want to strongly, strongly encourage our residents to remain at home. Do not come out unless you are on a critical mission, and we've got all of those listed in our emergency order. Golf courses are closed, all golf courses, as well as parks. So on that note, I will turn it back over to the commissioner, the mayor.
Thank you, Virginia. We're also pleased to be joined with state leadership and State Representative Emily Schlossberg, who has joined us in the lead to obtain an additional drive-through testing site here in Palm Beach County. And with that, we'll open it up to questions.
Commissioner Bernard mentioned this, but what would be the threshold for the county to issue a shelter-in-place order, and has that been discussed?
It's been discussed at length, and I can tell you that this order that's before you, that's been executed or will be executed by the county administrator, is in effect a shelter-in-place with some minor cutouts for our economic stability. I think that if Palm Beach County continues to abide by and lead by example in the way that we self-isolate and social distance, that we won't have to do that. But if the reaction to this most recent order and the dramatic increase nationwide of the positive test results is, then we're going to go to shelter in place, and there's definitely support for that.
How much more restrictive would a shelter-in-place order be? I mean, it basically sounds like you said, that's what we have in place now, but what would be different if you gave that order?
You know, the practical effect I don't think would be much different, except for it's the government saying you cannot leave your house except for essential reasons. Now, do we have the resources and the law enforcement to be essentially hall monitors for a community of 1.5 million people? No. That's why this story that we're writing and the end of this story depends on our personal responsibility and our personal accountability. You shouldn't have to have the government restrict you in your movements if your movements are in of themselves dangerous to yourself. But if we have to get that to that point, then the next press conference will be a shelter-in-place order from your county government. Can I go into more detail about the new tests? Okay, so did you say testing site or tests? Because there is some evolution in the tests themselves. They now are the FDA is about to approve some testing where you can do it by blood and there's a initial response within 15 minutes. That's on the testing side. Testing sites, I've spoken with Department of Emergency Management State Director Jared Moskowitz and the governor's office as recently as yesterday, and they have authorized a FEMA-funded testing site in this county. There's an application that they've signed off on. The caveat is that we have to provide some of the testing swabs because the federal government and the state government don't have access to them right now. And so we are literally, with our procurement department, sitting in the EOC trying to find the necessary products on the private market, and we will do that, and we will have testing sites up in this county. We'll even go as far as purchasing our own testing kits and setting up our own testing sites if the federal government continues not to come through. I would like to have a formal answer from DEM by the end of this week, by Friday, as to whether we're pulling the trigger or not. Otherwise, Plan B is we're gonna take matters into our own hands.
Maybe just for a little bit more clarification, why, if we do not want to come to New York or California, why not put that stay-at-home order in place now as opposed to waiting until the next press conference?
Well, I don't want us to get into an analysis where we have to look at Palm Beach County as if we are New York, okay? We are not an urban core like Miami-Dade, even like Broward. Broward has over 500,000 more residents than we do. Miami-Dade has over 1 million more residents than we do. The city of New York has 8 million residents, if I recall correctly. That's not to minimize the urban core that we have in this county, but the same recipe is not going to be the same for every jurisdiction. And I'm pleased with, thus far, with the exception of the boating community and the way that they were congregating out on Peanut Island and the Sandbar up north. I'm very proud of the response that this county has mustered in terms of social distancing and flattening the curve.
For non-essential businesses closing, is it just the county or does this include cities like West Palm Beach, Lake Worth? And for their being closed effective at 4 p.m., does that mean they have to close right now their doors?
I'm going to turn that over to our county administrator.
We are making the order itself effective, but we will be giving businesses time to ratchet down. And again, I want to point out, we do not have non-essential businesses in Palm Beach County. We're talking whether they're critical to the mission of what we're doing right now. So we have not used essential and non-essential to our businesses in Palm Beach County. So it's more critical. I want to stress that because our businesses, our business community is important to us. All of our businesses are important to us. So right now we need to focus on what is critical to our mission and making sure that we stunt the rise in the growth of COVID-19.
Does this include critical businesses and cities?
Yes, it does. It is countywide. When we issue these are countywide emergency orders.
And do the golf course closures include private golf?
Yes, ma'am, they do.
What have been the barriers to the county being able to open drive-through testing sites? Is it having a location, getting permission from the state or federal government, funding?
It is getting permission through the state and federal at this time. Yeah, we have locations that we could easily slot testing sites.
What is the reasoning you guys think that we have such a low number of people being tested? Could you not look at that as a positive, is that there aren't enough people out there that are feeling like they need to be tested?
That can be a potential answer, but we don't know. We don't know what we don't know, and that is because we haven't been testing everyone. Even the numbers that you get from the testing sites, those are people that have had symptoms and they have been tested. But for most of us standing out here, we have not been tested because we haven't had any symptoms. So we don't know what that number is going to be. I am telling my staff, and I'm telling each and every one of you, that we should behave in a manner in which we think the person we're talking to, the person we're standing next to, already have COVID-19. And we should govern ourselves accordingly by standing 6 feet away from each other. If we're sick, stay home. If you happen to have to go out, make sure if you've got a cold, you've got your mouth and nose are covered. So that is that we just simply need to take those extra steps to ensure that we no longer are continuing to spread COVID-19.
I'm sorry to be a pain, but I'm just curious, what is critical and what is not critical? What is considered critical?
Critical to our mission, and that is to keep the life and safety and the well-being of our residents moving forward. So as we stand here, we need grocery stores to be open. So we need trucks on the road to get the groceries to our stores. We need to have our drug stores open. We need to have our medical facilities available to us to treat us when we need treating. Those are the critical kinds of things that we need.
And then everything else is not,
And
would be closed?
they would not be critical to this mission.
Are restaurants still allowed to be open?
Yes, we are going to give them time. We're making this effective today at 4 p.m. because that's when the press conference is happening. We're going to give them until close of business on tomorrow to be able to ratchet down their businesses. Some of our businesses that will be impacted will also be allowed to utilize the internet to sell their wares and their goods. They just won't be able to open that store and have people milling around within the store.
Has anything changed with restaurants, or are they still going to be allowed to offer takeout?
Yes, they are. That has not changed.
Are we going to be screening people from PBIA who are flying in from New York and New Jersey?
A lot of that depends upon what the federal government does. But if the federal government continues to not necessarily push this issue for us or the state, we're going to take some actions on the local level that we can legally take. We will be working with the sheriff's office to make sure that we're identifying these individuals and we have the appropriate information so that we may work with the health department to follow up.
And for people getting notices from their landlords saying, rent is still due on the first, and we will file eviction notices against you if you don't pay rent, what would you say to tenants that are feeling pressure?
I would say to those tenants that if you can afford to pay your rent, because it's just going to delay it. If you cannot afford it, then you still have rights. And no one can evict you immediately. They must go through a process. They must go through the courts, and then you must be served. And right now, we've got such significant issues going on. I do not believe that is going to be the priority of the courts or our sheriff.
Is the closing of the non-critical businesses, is that also in alignment with the situation that has happened with Congress in the sense that they've already passed the stimulus bill, knowing, the counties knowing that there will be some help for non-critical businesses that will lose money?
We are working with our businesses currently, even with that bill being passed but yet not in effect. We have the Bridge Loan Program. We also have the SBA program. We're working with our Office of Equal Business Opportunity as well as the Housing and Economic Sustainability Department so that we can put that information out to our local businesses. We're also discussing with SBDC on how we can better train and assist our businesses in filling out those particular forms. So we're on top of that. I would recommend that if you want to know any more about SBA loans and the bridge loans, along with some of the other programs that the county offers to our small businesses, please go to pbcgov.org and go to the Office of Equal Business Opportunity as well as the Housing and Economic Sustainability. It is on our website. Thank you.
Is there word on how many masks, this may be for the mayor, but is there word on how many masks were Palm Beach County today?
We just received a very large shipment of PPE, so the broad spectrum of protective devices and equipment at our county staging site at the fairgrounds. I can't speak to how many thousands of masks we received, but the state DEM did come through and got us a very robust amount of protective equipment, which was very much appreciated. Any further questions? All right, with that said, we will be continuing to keep you up to date on any actions taken by our state and local governments and the federal government. I would make one plea to the federal government, and that is to consider halting domestic flights from the tri-state area in the Northeast into South Florida. I think that would be an effective measure to take. It's not one that we're empowered here locally to make, but I do hope that the federal government does pay some credence to that request. With that said, yes, sir.
One more question.
Yep.
With the businesses that are supposed to close down, let's say you find a couple that don't, are there specified penalties for those?
Yeah, so a violation of these emergency orders is a second-degree misdemeanor, which can include up to 60 days in jail. Obviously, it's not our intent to throw people in jail, and that's at the discretion of the sheriff and his deputies. But these measures are intended to be followed, and they come with the force of law. I didn't mention earlier, but included within these is a restriction of new reservations at hotels within the county. And so we've included them. Believe me, residence and lodging is a critical mission in this county, and we need to make sure everyone's housed and protected. But we cannot be an escape valve or release valve for Broward and Miami-Dade, who have New Yorkers flying in to escape the conditions in their state. And so it's a difficult decision, but we have to stop taking reservations at hotels and in effect close them to regular commercial traffic. We may have to reutilize or repurpose the hotels under our emergency powers going forward, but it's not going to be used to house those folks traveling from New York.
My producer, I have one more question.
Please.
What about daycares? Are they considered critical?
Daycares are allowed to remain open. I think they are, obviously, by definition, are critical, and I'm not misstating the law. Yeah, so obviously there are some very, very strict precautions that need to be taken when you have a large contingent of children in one room together. That's not something that I'm an expert on, but I'm sure that these facilities are complying with those restrictions, but certainly they need to remain open. Yes, ma'am.
I've had viewers come up to me that have school-aged kids that have been, taken out of school, and now they also have kids in daycare. They don't feel comfortable teaching their kids to daycare, but they're still having to pay thousands of dollars regardless. Is there anything you would say to those parents?
My heart goes out to them, and these are not easy times. So it's time to reach deep into our inner community and find ways to help each other out while still abiding by those social distancing norms that we need to. And I can tell you that this is happening over time. I can see a change in the behavior of our county and the nation at large. And some of those changes needs to be embracing your neighbor and assisting with childcare and going to the store for the elderly while still maintaining our social distance. It's time for us to be a community, and that's what we're trying to save here.
For those who are going to be, with this new stimulus, for those who are going to be getting those $1,200 or more checks, how would you like to see them spend the money in the county once we get the economy going?
I'm just a local official, sir. I can't opine on how best to utilize the resources from the federal government. I just hope that it comes, not just in money, but in resources as well. All right, thank you, folks. Have a good day.